Depending on the physical condition and the type of nutrition needed by the patient, doctors decide the method of feeding that needs to be followed. The different types or methods of feeding are classified as oral feeding, tube feeding, and IV fluids or intravenous route. Let us learn about them one by one. Oral feeding. Oral feeding is provision of food or fluids using spoons and other normal cutlery that are used to serve food at the table. This is suggested for a patient who can perform the daily activities normally and is able to respond to the instructions given by the assistant. You must arrange for the food and the required cutlery. Before serving the food, ensure that food provided is according to the diet plan given by the expert. Serve the food to the patient by the hospital bed. While feeding the patient by this method, encourage the patients to eat by themselves. If, however, they are unable to eat, then help the patient by feeding him or her. Tube feeding. Tube feeding is a type of external nutrition which is delivered into the digestive system in a liquid form. It is most often used to administer nutrition and medications to someone who is unable to take in food, fluids, and medication orally. Sometimes it is used in addition to the oral feeding method. The most common type of tube used for feeding is called the Ryle's tube. Ryle's tube is also called a nasal tube or NG tube. The Ryle's tube is placed through the nose into the stomach or the small intestine. Sometimes it is surgically placed into the stomach or the intestine through an opening made on the outside of the abdomen, depending on how long it will be used. The insertion of the tube is a specialized technique that is done by the doctors. You must ensure that the patient is feeding properly with the help of the tube. Intravenous fluids. An intravenous line is a short-term device used to give drugs or other fluids directly into the bloodstream through a vein. IV fluids are given as nutrients to those patients who cannot feed through the mouth. Simple IV lines or catheters may consist of a hollow needle connected to a tubing through which medications, saline, or blood may flow. IVs are inserted using a needle that is removed from the skin once the catheter is in the vein correctly. In some cases, IV lines are commonly placed in the hands, arms, feet, or scalp. The IV line is usually inserted by the nurse on the instruction of the doctor. You must monitor the level of the IV fluid from time to time and report the same to the nurse. This feeding method can supply all of the nutrients that the body needs. General principles of feeding a patient. Patients should be allowed and encouraged to be as independent as possible. Check the patient records for any instructions in diet to be followed or any food to be avoided. A person may need to follow a special diet because of a medical condition. Patients must have enough time to feed themselves. They should not be fed to speed up the feeding time. Check, record and report how much of what the person has eaten. Write down the person's name and how much of meat, peas, potatoes and milk or other fluid they have eaten. If the person has not eaten well, you must report this immediately to the nurse in charge. When feeding someone who cannot feed himself or herself, sit on a chair close to the person so he or she can see or hear you. Talk to him or her about the food you are feeding. A person who has had a stroke may feel weak and numb on one side of the body. In such a case, sit on the side that is not numb or weak. Put the spoon on the side of the mouth where there is feeling. Be sure food is being swallowed and not collecting on the numb side of the patient's mouth. Stop feeding a patient if they tell or show that they have had enough. Stop feeding a person if they fall asleep during the meal. Give 5 to 6 small meals during the day instead of 3 big meals. Offer healthy snacks such as fruit or cheese when a patient is hungry, even if it is not time for a meal. If the patient can walk, encourage him or her to walk before a meal. Walking may help in gaining appetite and helps the body digest the food. With these basic principles in mind, you should ensure that the patient is comfortable while feeding and the essential nutrients are provided to the patient.